Let us get oriented with the diagram. What you see in front is the anterior abdominal wall. What you see behind is the iliopsoas, basically the iliacus muscle, which is actually a muscle arising from the ilium of the pelvis of the hip bone. So here is the posterior and this is the anterior. So anterior abdominal wall is lined inside by a fascia called as a fascia transversalis, and the iliacus muscle or the iliopsoas muscle is lined by a fascia known as the fascia iliaca. So by and large, the fascia transversalis is in front and fascia iliaca is behind in the pelvis. Now let us see the external iliac artery trying to escape out of the pelvis into the anterior thigh or the front of thigh. So the external iliac artery, the moment it reaches the anterior thigh or it crosses the inguinal ligament, it is called as a femoral artery. So the femoral artery, when it escapes the anterior thigh, it is ensheathed by these two fascias, that is transversalis fascia in front and fascia iliaca behind. This ensheathing is called as the femoral sheath. Now look at this picture. It's the same picture as before. Now you can see how the femoral sheath is ensheathing or enclosing the femoral vessels. Okay, so that's the iliacus muscle, fascia iliaca, fascia transversalis, femoral sheath enclosing the femoral vessels. Now this is a schematic picture where the femoral sheath is shown separate, and you can see the femoral artery is lateral, femoral vein is intermediate, and there is a space also in the femoral sheath medially where you can see few lymph nodes. This space medial to the femoral sheath is called the femoral canal, and the entry, this part, is known as a femoral ring. So here it's another schematic picture. We can see here is this femoral ring medial most, intermediate the femoral vein, and laterally is the femoral artery. Now you must be wondering where the femoral nerve go. See, femoral nerve is seen outside the femoral sheath. See, just because you can see the femoral nerve is outside the femoral sheath, because, so you can see the iliac fascia here, because the nerves are arising from the inside the vertebral canal, which is obviously placed behind the muscles. So that is why the femoral nerve is seen outside the femoral sheath, not inside. Thank you.